and healthcare disparities have been an enduring issue in the United States. It has been a long-lasting problem of people of color receiving an inferior healthcare to people who are white. Healthcare disparities refer to the differences between different groups in access to healthcare, health coverage, and quality of care, while health disparities refer to the differences between two groups in increased illnesses, disabilities, and mortality rates. Health and healthcare disparities result from both structural racism and implicit bias. Looking at the effects of implicit bias, structural racism, and lack of medical research led me to my essential question: what are the effects of implicit bias and structural racism on healthcare for racial and ethnic minorities? Firstly, bias, prejudice, and stereotyping by healthcare professionals all lead to unhealthier outcomes for people of color. According to Chloe Fitzgerald, a postdoctoral researcher at the Institute for Ethics, a study was conducted to measure the levels of implicit biases displayed by healthcare professionals. The implicit association test, a test used to measure the level of implicit anti-black bias, found a substantial relationship between healthcare professionals who had IAT scores that displayed implicit biases against African Americans and interactions that were negatively rated by patients who were African American. The study also found a significant relationship between high levels of being pro-white and treatments that favored patients who were white. When health professionals are implicitly biased towards patients of color, it can potentially change the way they treat patients. This idea is also demonstrated through the words of Kelly Hoffman, an associate researcher, where she claimed, "Black patients were significantly less likely than white patients to receive analgesics for extremity fractures in the emergency room, despite having similar self-reports of pain." Furthermore, Esther Chu, an associate professor of medicine, gives another example of how implicit bias affects a patient of color. She claimed, "Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. The reasons behind these racial disparities are many and complex," she said. "Lack of access and poor quality of care are the leading factors, particularly among women in lower socioeconomic levels. Therefore, implicit bias is in fact displayed by healthcare professionals, and it leads to unhealthy outcomes which increase the chances of illnesses and death." Some healthcare professionals might believe that bias towards a patient can be beneficial because their background knowledge about a patient or a community is helpful when diagnosing and giving treatment plans. However, implicit bias can affect a healthcare professional's judgment. This is demonstrated in an article written by Joseph Bettencourt, an associate professor of medicine at Harvard Medical School. He claimed, "A study found that physicians tended to associate African American and patients of low socioeconomic status as being less intelligent, more likely to engage in risky behaviors, and less likely to adhere to medical regimens, even when controlling for the person's true socioeconomic status and personality attributes and degree of illness. Thus, bias is impractical and leads to negative outcomes." Secondly, people of color are less likely to receive healthcare services than people who are white. According to Monique Tell, practicing physician and clinical instructor at Harvard Medical School, this is caused by a number of different reasons, including unequal access to a proper education, nutritious food, decent wages, and housing. For instance, the Deficit Reduction Act of 2005 required that applicants for Medicaid provide citizenship documentation, and later on, in 2010, the Affordable Care Act still denied undocumented immigrants Medicaid and also limited immigrants with restrictions. These requirements result in fewer people receiving healthcare services because it makes it more difficult for them to afford insurance for healthcare. To further support Tell's idea, Daryl Gaskin, a professor in health policy and director of the Johns Hopkins Center for Health Disparities, states that residential segregation is a significant factor of less people of color having access to healthcare. Residential segregation is a physical separation of 2 or more social groups into different neighborhoods. Residential segregation plays a role in healthcare inequities because it is mainly responsible for the lack of healthcare workers, transportation, and others. Consequently, all these factors play a role into making it more of a challenge for ethnic minorities to access healthcare. Therefore, it results in less people of color receiving healthcare services. It might be thought that it should be the responsibility of people of color to attend healthcare services. However, obstacles like structural racism make it harder for them to receive a good quality of healthcare. Richard Blanco asserts in The Gulf Motel, "I want to turn the Gulf courses back into mangroves. I want to find the Gulf Motel exactly as it was and pretend for a moment nothing lost is lost." The concept of structural racism is similar to the words of Richard Blanco because, like the gentrification of the Gulf Motel, people of color are separated and moved into poorer neighborhoods, thus getting less healthcare services or lower quality of care. Finally, medical research does not properly reflect ethnic and racial minorities due to not being included in clinical trials. When medical research does not include people of color, treatments can pose as a danger and may not work. This is confirmed in an article written by HDP Health, where they claim 40% of Americans are people of color, but they comprise less than 5% of participants in medical research. This is one of the reasons they are dying of many diseases at higher rates than white Americans. This is demonstrated by Ray Ellen Bichel, a scientific journalist. She claimed, The blood thinner clopidogrel is ineffective for 3/4 of Pacific Islanders because their bodies do not produce the enzyme needed for it. Additionally, albuterol, the most commonly prescribed asthma medication, results in no improvement among 67% of Puerto Ricans and 47% of African Americans. Alternatively, it might be thought that it should be the responsibility of racial and ethnic minorities to participate in clinical trials. However, people of color do not participate in clinical trials simply because they do not want to, but in many cases they are distrustful for good reason. HTP Health explains how the Tuskegee experiment is an example of why people of color might be distrustful towards clinical trials. It was an unscientific experiment created in 1932 by Public Health Services in Alabama. They recruited poor African American men who had syphilis but did not know it. The doctors lied to them and told them they had bad blood and gave them placebos even when the disease became curable. This picture shows an African American getting his blood drawn for the experiment. The men ended up dying, went blind, or became insane, or had other severe health problems. All these healthcare disparities evidently impact a person of color's health and ultimately lead to worsened illnesses, and in some cases even death. The first and most important solution is to raise awareness of racial and ethnic disparities in healthcare because it helps change attitudes and knowledge. In the letter from a Birmingham jail, Martin Luther King states, "Injustice anywhere is a threat to justice everywhere." It will not be known that if awareness is not brought to the issue of healthcare disparities, it will not be known that something needs to change, and the disparities will continue to persist and get worse. The second potential solution is to reduce disparities in healthcare is to hire additionally qualified physicians who are from underrepresented minority groups. This helps strengthen the relationship between patients of color and healthcare professionals and essentially reduces the implicit biases between the groups. The last solution is to lower overall healthcare costs. When healthcare prices are high, it increases the amount of uninsured people, thus leading to a lower quality of care. Essentially, all of these solutions will help reduce health disparities and worse health outcomes for people of color.
How did your, wait, is this one? No, this one? Okay, sorry. How did your research question evolve as you moved through the research process?
At first, I wanted to focus on how medical research affects patients of colors and how they cause health disparities, but then I found out that health disparities are caused by more than one thing, like structural racism, implicit bias, and many others.
And what might be the real-world implications or consequences of your findings?
People of color will, if the disparities aren't fixed, people of color will continue to die at diseases at higher rates. They won't be included in clinical trials, and their health will get worse.
Very good. Thank you.